There are 1,890 new cases since yesterday. We currently have 18,342 active cases across Victoria. I'm sad to have to confirm that 5 people have died with COVID-19. A male in his 50s from Melbourne, a male in his 50s from Brimbank, 2 men in their 70s, one from Maribyrnong and one from Wyndham, and a woman in her 80s from Yarra. This will be an incredibly difficult time for their families and friends, so we extend our deepest sympathies and our best wishes to each of them. 609 people are currently in hospital with COVID-19. 126 of those are in ICU and 88 are on a ventilator. Of the people in hospital yesterday, less than 7%, were fully vaccinated. Again, if you are vaccinated, you are protected. Those you love are protected if they're vaccinated as well. And your chances of finishing up in hospital gravely ill are but a tiny fraction of what an unvaccinated person's risks are. And of course, that will change and become even more stark as we open up. When we get to 70% double dose, and we're on track to get there, and we may even get there a little bit earlier than the 26th. And then as we hit 80% double dose and we really do open up, lots of movement, the virus will spread, particularly among those who are not vaccinated. And if you're one of those unvaccinated people, then you are at a much, much greater risk. I'm not pleased to have to say this, but it's just the science of it. It's the data, it's the facts of it. You're at a much higher risk of finishing up getting this. And with Delta, we know that if you get it, then there's every chance that you may finish up unwell, even if you're otherwise healthy, even if you're otherwise fit and don't have other health conditions. So for all those reasons and so many more, it's really important that people get vaccinated and get vaccinated as soon as possible. To that end, there were 39,861 doses of vaccine administered through our state-run centres yesterday. That's a really big effort for a Saturday, almost 40,000 people. Plus, of course, there'll be tens of thousands more at our GP clinics and, of course, trusted community pharmacies, hundreds of them right across the state. So yesterday, I'm sure, given what we did in state hubs, will have been a record-setting day when you added all of those vaccinations together. The majority of those, speaking again for ours, the ones in state hubs, so around 40,000, the majority of those were second dose. That's to be expected with the bring forward of the intervals, as well as the fact that we're getting to a very, very high first dose rate. It just logic tells you that we now move much more towards second doses, and that's what we want, because we're now in a race to get to 70% double dosed as soon as we can, so that the lockdown can end, the curfew can end, and we can begin to implement the really big and important pieces of our roadmap to deliver the national plan. The majority, as I said, of those were second doses. We do expect our double jab rate to accelerate and our first jab rate to slow, as I've just explained. We are encouraging people to bring forward their second dose. There are appointments available just in my own household, just through the normal booking system. Joe and Grace both brought forward their second dose appointments, went down to Sandown and had their second doses in this week, just ending now, I think Wednesday, Thursday. And I think Noah did his similarly just a week or so before then. So there are appointments available through the state booking system. If you can't get an appointment there, then there are absolutely appointments available through pharmacy, and there are appointments available through GPs as well. There's a lot of supply across all 3 of the trusted, approved, safe and effective vaccines, and I'd encourage everybody to go and do that for themselves, for the people they love, and for all of us, because it really is the key to us getting open and getting open fast. I can confirm that we've now gone over the 86% single dose mark, and that's for 16 plus, and over the 58% second dose mark. So we are well on track to get to 70% double dosed on time, as the roadmap outlines, 80% double dosed just a short time thereafter. And if you look at the number of first doses we've administered, and the fact that the vast majority, in fact all but a handful of people come back for their second dose, we'll go beyond the 80% barrier as well, which is terrific, because every person who's vaccinated is one less person at higher risk of finishing up in hospital. We only have a couple of weeks to go. We've only got a couple of weeks before we'll be able to get to that 70% mark, and before we'll be able to really begin the process of opening up in earnest with greater freedom. And by the time we get to 80%, only a little few days after that, that's when we can really get back to something that looks and feels and is much like normal. We'll then take further steady steps along the way after that. But getting vaccinated, either first dose or bringing your second dose appointment forward, or just turning up for your second dose appointment between now and whenever it falls due, is critically important. These milestones are important, 70 and 80, but every person who gets vaccinated is important to us. First dose, second dose, and then of course, once we get to next year, we assume, subject to announcements from the Commonwealth Government, we'll then move into booster shots for those people who need them.